guys, hope you're all doing good. So we are starting with our Kickstart series for Part 3 MRCOG. So here what we are going to do is each of the mentors have taken one module, and it would be role reversal where mentors act like the candidates so that it is easy for you guys to observe and understand when the mentor puts themselves in a place of a candidate. And what I'm going to do is about the core surgical module. Obviously, remember, whatever you are trying to do, try to enjoy your journey, because part 3 is all about the lifestyle changes which you guys need to be doing from day one. And I'm sure with these YouTube series, you would be able to understand very well how to understand the verbal and the non-verbal communication of the role player as well. And most important task, core surgical skills is one of the most, I would say, variable task you can get it, and a bigger module as such, because it starts from taking consent. Okay, so you need to be filling up the consent form in the 10 minutes, and you need to counsel the patient as well. And you could get the gynae list prioritization in this. And obviously, pre-op rounds can come here, and post-op comes generally under post-op module. And any complications where you're returning to the theater, it could come in core surgical as well as in the post-op module. And the skill set task, like probably they could ask you the lap entry or the driving the camera, or even the hysterectomies and any complications. This could be a mixture of both core surgical and post-op. So today what I'm going to do is one such case of return to theater where there will be a lot of forms attached, which is a generally tested task, which can help you to understand how to go about as well. And there's a patient simulated task as well as a lay examiner task. Generally, these complicated cases will always be a lay examiner task as well. So we will be doing the scenario today. So what I'm going to do is the reading time of 2 minutes, I've cut short to around 30 seconds to, cover up the time. After that, we will have 10 minutes of role playing, and then we will go over the feedback. And Aisha has joined me today for the same one. Thank you, Aisha. Thank you so much for joining. We will be doing this. So let me start off. I'll be showing you guys all the slides which are in the candidate instructions. There are around 4 slides. And while giving the feedback, like once we have done the task, I'll tell you how to go through quickly these 4 slides in 2 minutes. Okay. So I'm going to start my time, and this is the task. So Aisha, we shall start the task. I'm just keeping the timer to keep this very close to the exam. Okay, ready, Aisha? Let's start.
Yes.
Marcus Riboria?
Yeah.
Hello, Marcus. This is Dr. Sowmya here, one of the doctors who is looking after the post-op wards. So I could see that you are in a lot of pain, and the nurse called me because you are in a lot of pain and you are continuously vomiting. So that's the reason I am here.
Yes, doctor. I just don't know what's happening to you. What's happening to me? Can you please relieve me from this pain and vomiting, doctor, please?
Yeah. Marcus, I can see that you are in real pain. You have been started on the pain pain relieving drip, which I can see, and also the nurse has already given you some medications which is of no use. I have gone through your notes. Actually, I have a couple of concerning things. Is it okay if I explain you very quickly, because it's important for me to explain the same to you?
Yes, because I'm in so much of pain. I just cannot answer to most of your questions, maybe. So could you please relieve me with this pain, vomiting, everything, please?
Yes. Marcus, what I could see is actually when I went through your observations, it looks like your heart is racing pulsing faster and your blood pressure is falling. So I'm really, really worried there is something serious concern here, and we might have to take you back to theater with your
Oh my
consent.
God. Oh my God. First of all, I'm suffering so much. And now you're asking me to go back to the theater. What's happening with me, doctor? Please.
Because I can see that you are really worried, which is a very genuine thing. However, I'm more worried about a couple of things. Probably you might be bleeding inside, which the picture, the clinical picture looks like that you might be bleeding inside. So that is what is really troubling me. We need to take you back to the theater so that to have a look. Obviously, I have already informed my consultant and the team will be here. But because your blood pressure is falling, it's very, very, very vital and important to shift you back to the theater to see what's happening, along with a couple of the tests which we
Actually, I
can.
need to talk to my partner. I need to tell him what's happening around me.
Yeah, sure, Marcus. Is he around?
He's away. Maybe he'll take another hour to come.
Okay. Marcus, I'm afraid I might not have, we might not have so much of time. Is it okay if I could arrange a telephonic conversation with him? Because I also need to talk to him about, give an input of what's happening.
That would be better. Yeah, you need to call him and tell him what's happening with me.
Yeah, sure. Marcus, I would be doing that. And Marcus, I really want to tell you, because I know you're in a lot of pain. I know you're vomiting, but at the same time, I want to tell you that we want to keep you safe and we want to make sure that everything is going well with you. I have quickly gone through your notes, which says that you underwent the removal of the cyst because it was twisted on.
Yeah,
Yeah, I have very few questions to ask you. Are you allergic to any medicines?
but not that I know.
Okay. And this, because if I'm suspecting, as I'm suspecting, the bleeding is happening inside, because you look very pale and there is heartbeat is racing up, blood pressure is falling. So probable reason could be you might be bleeding inside. So I would want to know, do you have any reservations for the blood transfusion
Yes,
or the blood and
yes,
blood product?
yes. I am a jehovah. I do not like to, transfuse any blood products to me.
Okay, okay. Thank you for letting me know that information. Definitely your wishes would be respected. Marcus, I just want to know, like, have you signed any advance directive
Yeah,
before?
everything is signed. Everything is signed.
Okay. One quick question. Even if it becomes risky to your life, do you want to take, do you
No,
want to?
I do not want anything.
Okay. Okay. Marcus, thank you for letting me know your wishes. Definitely this would be respected. So I understand that you're okay to take your own blood. That would be
Yeah,
all right.
that would be okay. That would be okay.
Okay, okay. So what I would do is I would call our technician who can do that as well. And I'll also include our Jehovah Witness consultant as well. So we would be quickly taking you back to the theater to make sure to understand what's happening. So just to give you an overall picture, probably what I understand is you do not have kids so far. Am I correct?
Yeah, because I think because of the ovaries got twisted, they had to remove the ovary, otherwise it could have caused some much more problem to me. But still, I do not have any kids. I want to have one as soon as possible, maybe. But now this problem, I have to go back to the theater, is raising all concerns to me.
Yes, yes. Marcus, I just want to tell you one small thing that actually they have removed only the cyst, the ovary is left behind still. So when we look into the, actually when we take you back to the theater, first thing your safety is the prime concern. So what we would be doing is we would be making sure that to find out from where you are bleeding, okay, and to catch all of those bleeders. And we will always try to salvage your ovary which is left behind, that is the left ovary. By any chance, if the bleeding is too much, probably it necessitates removing that ovary as well. But please do not worry, because there will be the right ovary which is actually healthy and there are no issues there. So I'm just trying to give you a like probably give a panoramic view of what can happen. So if at all, if you are bleeding more, then definitely if bleeding is not controlled, we might have to remove the left ovary. But do not worry, this will not affect your future reproductive potential.
Okay, that sounds okay.
Okay, so what I would be doing is definitely no more amount of pain relief would be helpful to you. So what I would be doing is I'll quickly arrange an ultrasound and take your bloods. Bloods basically we take to see what is the level of blood in your body. That's the hemoglobin, and also how the clotting function of the blood is working. That's the clotting test we would be doing. And also at the same time, I would be having a look into your kidney functions and as well as the liver functions. As I can see, the drain, the tube which is coming out shows a collection of the blood there as well. And the urine, the amount what we have to expect is less. So this is all indicating me that you might be bleeding inside. So we would be starting you one more IV line for you so that we can manage by giving you an adequate fluid. We will keep you warm. And once you give the, now you have accepted for this, so we will be shifted to the theater. There will be my specialist team, the group of doctors like consultant would be there, and as well as the blood doctor will be there to see what could suit you, and also the Jehovah Witness consultant and the specialist nurse would be there. So we would be, again, I know this is difficult for you, but this is very important for your life. So we need to again do the similar procedure. We need to find out where the bleeding is, and then we might have to stop the bleeding immediately. And if that necessitates, we could remove the left ovary as well.
Okay, so can you please call to my partner now?
Yeah, so sure. We would definitely talk to your partner. Is there any other thing which I can speak about? And of course, we would also, once he comes in, I would definitely, my consultant, and I would definitely speak to them. Any other concerns if you have got at this point of time?
Yeah, so my concern is whether my blood, which you are doing the salvage thing, will it help me to improve the situation? That's whatever the blood has been lost.
Yeah, the point is because that is one of the things which can help you. So obviously this will go through the filters and get back to you in the same circuit as you are willing for. And the amount of blood loss, whatever you have lost, that has to be replaced. So if it is your own blood, that could serve the purpose as well.
And so what about the infections? What are the chances of infection with that procedure?
Yeah, the thing is, like, if at all, see, definitely, because once this is returned to the theater and we will be putting you back to the high dependency unit for some time for monitoring for sure. And we would be taking you care by giving you the broad spectrum antibiotics after ruling out your allergies so that you will not get the infection. And obviously we will be having a close monitoring of the same as well. As you rightly asked, you could be at a little bit increased risk, but we can prevent them by giving you the correct antibiotics, the IV antibiotics,
Yeah.
the injectable antibiotics.
Okay, so once I'm out of the theater, so after how many months or weeks can I become pregnant again?
See, definitely that's a very valid and a genuine concern. This depends upon how well or how quick you feel ready. Okay, so once your recovery is on the way, once you feel you are ready, you could definitely go ahead, because this has nothing to do with the pregnancy, because was a cyst which was probably unnoticed for a longer time, and that's how you had got it probably. So this suddenly got twisted, so that could be the reason. So once you feel you are ready, and once there was no other problems which is following and your recovery is smoother, you can try to become pregnant. That's not a problem at all. Of course, at that point of time, we'll give you the information leaflets so that you can go on. And of course, we would be writing a letter back to your GP explaining the whole situation, what has happened.
Okay.
Okay. Yes. So I would definitely go ahead with the arrangements. Thank you so much. And I know that you are in pain, but do not worry. This would be sorted out very, very quickly. Thank you, Marcus.
Thank you.
Okay, we finished because there was, I think, another 10 seconds was there. Yes, Aisha, what's your feedback for me?
I think I should have been more aggressive because in the real scenario, sometimes the role players are in this type of condition.
Yeah, indeed, she was for me.
Yeah, they will be more aggressive. Yeah, but the good part is that you have tried to, console me by giving the apt sentences or reassuring me that my safety was of prime importance. And also, you were quick in asking about the blood products and the reservation and advance directive, which was very good. And then also coming back that you were not judgmental that you have to take the blood, otherwise your life is at risk. You were very empathetic and explaining that there are other procedures which is suitable for you, which was very good. So that's how the role play of, she calmed down a lot. So
okay, thank you. Actually, yeah. In my exam, what happened? She was very, 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 very angry, very, 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 very upset. And, like, I think 6th or 7th minute, she calmed down, if I could remember. And that's how I quickly covered a lot of things. And so guys, here the point is there will be a lot of papers, how to go about. So I always say there will be one master slide, and this is what the master slide is, which talks about what type of task it is, whom you are going to meet, and what are the domains you are actually are supposed to be covered. This is the master slide. So in 2 minutes, you take 30 seconds for this. And when you see this chart, obviously, you can see that the things are, the respiratory rate is increasing, saturation is falling, and the heart rate is increasing, blood pressure is falling. So you need not even go into see what is what. So many things are in red. And this is very important. Why? Drain has got so much of blood. So think of intra-abdominal bleed. Please do not talk about, I've seen people talking about bladder injury and all, but here the main thing is there's a tachycardia, hypotension, and the urine output is falling, obviously, as a feedback mechanism. And here the operative notes, there is nothing much. Okay, so you could see the indication, you could see what has been done, and if there is any specific things which they have mentioned, like what are the prostheses or the drains, whatever you have put. And here, remifentanil, that is a patient-controlled analgesia. Don't worry about the dosages. Just quickly brush through what has been given. Okay, and points not to miss. Please remember she's in pain. So do not keep on asking everything. I didn't even bother to ask her habits, because at this point of time, I am not worried about her habits or about her family history. If you could see, I have hardly touched upon things like the allergies and the Jehovah Witness, because rest of the things, I know she had a torsion for which she was operated. That is more than enough, rather than asking what sort of cyst, what, it doesn't matter to me now. This is an emergency. And the next thing is read the instructions carefully. New start shows tachycardia, hypotension, hypoxia. So you must be very quick accumulating the facts, and increased drain in the blood and the less urine, all indicating it is a very, very important. Even in exams that probably you might forget to ask, but when you are talking about returning to theater and collecting the blood for blood transfusion, at least remember then that you have to ask the Jehovah Witness without fail. This is not a hidden agenda. This is a straightforward case. Was you, if you did not ask the history, you would be missing. So it is not a hidden agenda. For everybody who needs blood and blood products during the theater time, you need to be asking before. Concerns for fertility. Obviously, she's nulliparous. She is more worried whether whether she would not have kids. And if you could see, Aisha said that ovary was removed. I had to slightly correct her, telling no, ovaries are still there, only cyst was removed. This could happen with the patient also. Okay, so make sure that you listen, understand, and then respond. And return to the theater is a very big thing. Actually, I wanted to talk to her. She was not upset or angry, but sometimes they could be very, very, very angry, where they say, what is this? Will this happen to everybody? Then you can say that, okay, things are taken very seriously, and there will be detailed investigations. And if there is any error from any side, the consultant would sit with you and take you through what exactly we have done to prevent this from happening. They could ask you the similar questions. Okay. And the consultant's presence is very, very, very important. Once she said about Jehovah Witness, I also included Jehovah Witness consultant and the specialist nurse. And you need to, and very, very important, if you have noticed, you need to tell a Jehovah Witness when you take the blood for what it is, because they are always worried that they don't want to take the blood unnecessarily. So these are the tasks which are actually a common sense task. Like sometimes you get worried looking into so many charts. So desensitize yourself by going through a lot of papers in 2 minutes and see what is master chart and look into the things, whatever is important, because there could be a triad summary which you need to read very carefully in ER, if at all, if they have given. If they've given multiple charts, sometimes if they give a disease XYZ new one, they would give a lot of information on that. Always try to look for the flow charts. Always try to, at a glance, how do you read the charts is very important. So practice that. So this task I did particularly to put so many things together about the hidden agendas, about the charts, and how to console the angry patient. And if you could see, she was continuously omitting. In the real exam, they would be omitting. After 6 or 7 minutes only, they would stop. So do not get worried so much about, because the role player is doing their thing. So basic agenda or basic tips and tricks for this is, please make sure to practice a lot of angry, depressed, sad, or probably somebody who is not at all talking. There could be scenarios like that. So that would help you. Hope this was useful, guys. So this is the first of Kickstart series. All our wonderful mentors would be doing a different task like this. And hope you are enjoying the role reversal, because it is always bring in a lot of quality That is the reason we have started off this. And please do not forget to like, share, and subscribe and watch them. Watch every single video to understand how well you can adapt to the situations, how well you can do. Remember, people, whoever is thinking of preparing for part 3, everybody face challenges in the beginning of information gathering. They take a lot of time. You might be little worried. Don't worry about the beginnings. It's always what you choose and what you become towards the end is important. If I and Aisha can pass, you guys can easily pass these exams. So it's just an exam of common sense. Practice, prepare, and have an overall look of how you could do. Okay, so I don't know. Just a last comment. Aisha, did I use any jargons? Because I was talking so much, so I didn't realize. Did I speak any jargons at all?
No, I did not realize it.
Okay. Okay, perfect. And I remember IV, intravenous IVs, I said, then I came back and said injectables. It can happen. It can definitely happen. And this would be a lay examiner task. So please make sure that you guys will not be using anything and appropriate facial expressions. And, those things are very important for the lay examiner and how non-paternalistic you were. Okay. Thank you, guys. Thank you so much. And Aisha, thank you so much for always being part of this series. Thank you, darling. Thank you so much.
Thank you. Thank you very much.
Bye.